Welcome to the Dental Breakdown Show. This show is where we break down issues in the dental marketplace. My name is Christian White, CEO of White & Associates Practice Consulting, Better Business, Better Dentistry. Today is podcast number 21, and we have Dr. Frank Milnar, the President and CEO of Milnar Mentoring, on our show today. Dr. Frank, welcome.
Christian, thank you for the invitation once again. I always enjoy being with you and adding education and content to our profession of dentistry and to all the dental teams.
Well, thank you very much for making time to be with us today. Why don't we start out by having you tell all of our listeners a little bit about yourself?
Well, I've been fortunate to be a clinician for 43 years, and what an inspiring profession this is with mentors. But most recently, as an educator, a publisher, and a consultant for many clinical corporations, I've developed and founded Milnar Mentoring. I'm the president and CEO of MilnarMentoring.com. Well, Milnar Mentoring is designed to make you more confident and competent with your clinical dentistry by receiving my personalized mentoring skills and advice, recommendations, which reduces your procedural times and increases your production, Christian. I've learned a lot and I'm willing to share it with you.
Well, thank you very much for that. I think as our audience can see by looking at the first slide, what is the new norm after the COVID-19 virus piece? We want to talk about that. But I think we also want to talk about how is that going to affect the younger dentist, Frank. You have a lot of experience working with younger dentists. You do a lot of mentoring with them. Let's start out by talking about that.
Well, Christian, we have to go back in the time machine, and I will tell you that in dental school 1972 through 76, we didn't wear gloves. There were still some spittoons. By the belt-driven hand pieces, we had tackle boxes of instruments that weren't sterilized, that we would use them, including a bottle of mercury. And so when we went through dental school, we had two colors, silver and gold. That's all we had. Now, you can imagine, even in private practice, when I came out in 1976, we didn't wear gloves. We were doing a heck of a lot of mercury fillings. I mean, that's all we had, and a lot of gold. So this was my normal. This was the new normal, but I was part of the revolution buying dental practices from elderly dentists in the community that were solo practitioners. We as new graduates would come in, work with them for a little bit, and then they would exit. And then we would be entrepreneurs and owners of the dental practice. There was no corporate dentistry back then. You had a place to get into a dental practice. The elderly dentist would exit, and then you would own the practice. And now we were part of the new revolution of white fillings. Okay, been through the first revolution. We were the test pilots for all the dental materials that failed. And they did fail. And then the corporations learned from it and then reissued it, and is the new and improved. And once again, we were the test pilots for everything. So what am I saying? I am saying that you're talking to the Chuck Yeager of dentists. We went through the sound barriers. We went through Mach 2, Mach 3. We had flame outs. We did everything. And now we hand you, the new generation of dentists, everything has been vetted. There's no bad products in the marketplace. So that was our new norm. We rode the slope of technology, and most recently, scanners, milling machines, digital workflow. You're talking to a baby boomer that's just trying to hang on right now because things are speeding up, and the new generation will be the new norm, except there's a big asterisk. When somebody asks a new dentist, a young dentist, when did you practice? The first thing they're going to say, I came out right during the COVID virus.
Mm-hmm.
Okay, that is their beginning, and it's all changed, Christian.
Completely changed. So I think, Frank, as we move forward here, you're going to move to the next slide here. We're talking about the new skill set that the younger dentist is going to need to learn, to adapt, to be able to make it in this new corona environment that we're experiencing right now. Why don't you go ahead and talk a little bit about that?
Well, okay, let's be hypothetical. You're just graduating from dental school right now. Maybe you got all your requirements, maybe you didn't, maybe you had to take it on a typodont instead of a live patient for your board exams. But now, will your bench instructor from dental school help you into the new COVID normal for employment? My point is, you don't need a bench instructor anymore. You need a clinical mentor.
Mm-hmm.
Because you need the advice of somebody who can help you navigate. You're starting in turbulent waters. You just went over Niagara Falls. I went over Niagara Falls. And now when we finally get to the surface, we just said, holy crap, what just happened? Well, when you practice dentistry for the first time after COVID, during COVID, people are looking at you as the first line of the COVID diagnosis, temperature taking people. You're going to look different. You can't come out looking like you used to with a scrub suit and in a type 3 mask. You're going to have N95 masks, face shields, everything, surgical boots, everything. You're not going to look the same. This is what you need is a clinical mentoring. And what I did, Christian, as a passion of mine for education, publication, and consulting, I came up with as the president and CEO of Milnar Mentoring. This is my website that you're free to look at, has clinical questionnaires, etc. And my email is drfrank@milnarmentoring.com. You need a mentor today, whether you're going into corporate dentistry, private practice. You're going to need some skill sets for interviewing. You're going to need some skill sets for starting your clinical experience. And what you learned in dental school is not going to help you now, Christian. This is a brand new beginning for the graduating dentist.
Boy, you could say that with a capital B. Let me tell you, whew, that is no joke. So Frank, tell me, there's a clinical piece, but then if I'm a younger dentist, I mean, before I even get to do my first crown prep and my first, opportunity for employment, I have to be able to sell myself to a potential employer. And you and I both know that the younger dentists aren't always as well, you know, educated in this, or they're not as prepared. So talk to me about that. What is the younger dentist going to have to do in this new norm to be able to find employment, or to be able to sell an employer on why they should be hired?
Well, once again, what happened last year, I've had pre-dental students come in and shadow me in my clinic, and I've prepped them for interviewing on what people are looking for in missions, and I know what they're going to look for in any sort of private practice or corporate setting. Think about this, Christian. How much experience does the graduating dentist have? None.
None.
What is the public sector looking for? The patient's trust.
Mm-hmm.
How do you get that? It takes years of experience to do that. It's not what you're going to do to the tooth for a crown prep that you're hungering to do what you want to do and touch teeth and take them apart and restore them and all the clinical procedures that you're trained for. You have to know what it does to the tooth and explain that to the patient before you touch it. Not, you need a crown, Mrs. Jones. Let's get started. No. Mrs. Jones, can we talk about yourself and what you do? And then I'm going to tell you if you allow me to do this procedure, what is the risk to your tooth?
Mm-hmm.
We have to talk about that. Mrs. Smith, this is a deep filling. I may cause some sensitivity issues that you don't have today. You have to be aware of what I do and what the risk factors are. Mrs. Smith, you know, you've had a history of a lot of decay, and I'm really concerned about that. Maybe we should do a little more risk assessment on a questionnaire and make sure that everything is good before I take your tooth apart. Do you have acidic saliva? Should we be talking about therapeutic agents to control the disease before I do something in an acidic environment? Mrs. Smith, I think it's a good question that you know what the procedures I'm going to do, but I think it's also interesting, and it should be very valuable for you to know that I have studied engineering design. And besides the great products that we have in dentistry, I'm really familiar with how to re-engineer teeth and make a different model out of it than a typical dentist might. I'm very keen on the cause of failure.
Mm-hmm.
I know what can cause clinical failure, and I'm here to be a friend of yours, whether everything goes well or whether we encounter difficulties and sensitivities along the way. So we're going to talk not only about the clinical procedures, you're going to get what I stand for, my personal philosophy about what happens when we touch teeth. They're never the same when we touch them. They don't heal and go back to their original state. We alter it
Mm-hmm.
for the life of the patient, Christian, when we do that. So that's why I am a clinical mentor today. Now, before I proceed on how to talk to the patients, don't you think that's valuable information, Christian?
Yes, it is. It's a really big deal. It's kind of like, Frank, you and I have always said this, but I think it's even more important now. It's not necessarily, the tooth is not the vehicle that wheels the patient into the operatory. That's not how that works. I think now patients need to know, okay, if I am going to have a crown done, or if I'm going to have this root canal, how is my life going to change because of this procedure? That's a non-clinical benefit, and that needs to be communicated to them, not just we're going to have a nice line angle here, and we're going to have this particular clinical piece done to your tooth, because the patient doesn't understand that. What they do understand is how it's going to affect my life if we have that done. That's something that a lot of the younger dentists, don't always focus on. It's not necessarily so much on the teeth, but I think we'll talk more about that, Frank, as you continue to move through our presentation here.
Well, that's good, Christian, because whether you go through into corporate dentistry, whether you go into private practice, it's going to be the same scenario one way or the other. So
Yes.
when you look at me being a clinical mentor, I'm going to roll into the slides, and I wish I would have had these when I graduated. I had to learn myself the hard way. And when you start losing dental patients because of something you did and not explain, now you have to do some self-examination and self-assessment. This is me mentoring over live patients in Hanoi, Vietnam,
Mm-hmm.
and people are interested in dental education. So let's start. I'm going to roll into the slides and just give you kind of a formula for you to contemplate about building relationships, sharing risk assessments with the patients, and how can you get long-term success. That's why I don't quit dentistry, Christian. I'm 43 years of experience. My mentors went all the way up to possibly 50. I'd like that opportunity as well. Remember, young dentists, graduates, just starting out, 3 years of experience or less, dentists are experts on their own clinical skills, and patients are experts on themselves. You cannot overwhelm the patient with your dental expertise in clinical dentistry skills until you understand who the patient is, what are they there for? They're there for a problem. How do you make that problem go away? And give them an opportunity and education that they can understand so they can make a purchasing decision. It's price testing, but first, they got to get a vibe on you. Does their gut feeling say that you're the person to touch their teeth? You see,
Yep.
we in dental school are always about the how and the what. Well, how do we do it? What do we use? How does it work? That sort of thing. We want to focus on the why. Why are we touching the tooth? What is the benefit? The how and the what are irrelevant. You already know that, but the patient has the limbic system, which controls the emotional quotient. This is the gut feeling when they look at you in the eye and say, I can trust this person. How can they trust you is based on your whys, not your hows and the whats. If you talk to the hows and the whats to your patient, they're going to go on screensaver real quick. You know this. Tell your patient, yes, here's how I can take care of you in your tooth. This
Frank,
is why you can trust me.
I think
Your
it's,
treatment, go ahead.
no, I'm sorry. I didn't mean to interrupt you. I'm sorry.
But you have to have yourself is credible. Put the handpiece and the tools down, the instruments, put them down, look at them eye to eye, and just say, here's how you can trust me. I know how to do the job. I know what it takes. I can be there for you at any step of the way. I've got trained staff around me. We're on the same page. Your success rates are going to go higher by not picking up an instrument or a handpiece than you would if you spend time with the patient.
I
The
think,
young dentist,
hold on one second,
I'll
Frank.
let you.
So before you go, I think when you, what you were just talking about, the what and when you, and the how, when you, as a dentist, when you focus on that, that automatically, the patient automatically asks how much, because you haven't given them anything to really focus on except for how and the what, and that doesn't really mean a whole lot to the patient. So in focusing in on that, a lot of the younger dentists have a problem getting the patients to say yes to their diagnosis because of that, because it's the how much always gets in the way. And that's just a little something for all the dentists just to kind of keep in the back of your mind. Please continue, Frank.
Well, you're very true. I echo that, Christian, because they're going to talk about the how and the what because they don't do the whys in dental school. They just do the how and the what so they can graduate. But the patients are going to be sitting there and they need to know the whys so they can make a price test, and they're going to say how much. But if you don't give the why, the how much doesn't make any difference. They have no benefit to do that. Never try to talk your patient into a treatment plan that is in your best interest versus theirs.
Yeah.
I'm more profitable today as a 43-year experienced dentist by doing nothing, by getting trust from the patients, than I am during the clinic for the clinical skills. Never presume that you know better about the patient, what's in her best interest. Christian, you need a crown on tooth number 3. Let's get that going.
No, I don't.
No, you don't.
No, I
And if you
don't.
leave the room, what are they going to do? They're going to look at the assistant and said, why do I need a crown?
What in the
He
world
didn't
did
say
you just
anything.
say? Yeah, he said nothing to me.
He never said anything. Get to the whys before you say, get up to the front desk and we'll get you scheduled, because you need a crown on number 3. I think you're going to be disappointed. They're going to leave your practice and find somebody else.
Well, and they will, because I mean, the conversation was never about me. It's about a tooth, or it's a procedure, or it's number 14 or number 15 or whatever it is. And that means absolutely nothing to me as a patient. So what? I don't care. So what? How does it affect me? That's a big thing that is really missing in a lot of dental practices, and a lot of dentists just they don't focus on that, and it does. And the patients walk right out the front door and they don't say yes. They don't.
Well, Christian, if we soldier on here,
Go ahead.
one of the things I would tell a young dentist is, if you didn't know what the word was before you went to dental school, don't use it on a patient. They don't understand you have a fractured lingual cusp on an MOD amalgam. That means nothing to them. Just say you have a structural failure on a tooth. And now the tooth can't be a shock absorber, and the risk is that you can permanently damage the tooth, or the tooth may be lost. Not, oh, you have a buccal cavity on number 4. They don't know what that is. Don't use the words to the patients. Explain it in terms that they can understand it. Don't lap your patients. I've seen it where the dentists start talking too fast and they'd start going through treatment planning, and you're lapping the patient, and the patient, you're so far ahead, they don't understand it. And as soon as you lose them, you're lost. They're not going to, you may leave the room and they go up to the front desk with an estimate sheet of $5,000.
Mm-hmm.
They're going to say, I'd like to think about it. In other words, I'm going to go get a second opinion.
The Dental Breakdown Show, sponsored by White & Associates Practice Consulting. Better business, better dentistry. They are a practice management consulting firm for dentists and other healthcare-related businesses. Their sole purpose is to implement proven strategies through online and in-practice visits and result in the personal and professional success of the dentist and his or her team.
On the ground rules, probably the most important thing is the conclusion is you always have to tell the truth. And give your patient some time to process all the information. They're experts on their personal lives, whether the husband lost the job in the COVID crisis, the kids are going to college, you don't know if somebody's sick, and you have to tell the truth and use some of the guidelines, because they're going to look at you, and you have to say this with strong convictions about who you are as a person. They know what you are, you're a dentist, but they don't know who you are, philosophy, what you're all about. Do you represent the business, or do you represent their lives, their teeth? So you say to them, this is what I see. This is a clinical finding. This is what it means to you and me. Is it deep? Can it need a root canal? What's this going to do for you long term? Here's the implications and risks of these conditions. You may lose this tooth, but we have implants today. We don't do partial dentures. You may not need a bridge. I'm here to solve your problems. Here's how these conditions relate to the quality of your life, so you can chew, you can smile. And which of these problems you said were important to you, I can find a solution that makes sense, that we can all agree on, both you and me. You can ask questions anytime you want. When I leave the room, you can talk to my dental assistant. She's my co-pilot. She's very familiar. We're all the same. We come as a set. So when we say finally, after all is said and done, give them time to ask you questions. They're going to be shy. A lot of times they don't want to challenge the dentist, the doctor, but they'll ask the assistant, what did he say? You need to get them in a comfortable place to make a price testing and a decision based on what they feel the value of the why is and how it relates to their world versus your world.
Frank, and I think as a dentist and having spent a lot of time working with dentists, it's really important for the dentist to be able to look the patient in the eye and say to them, Dr. Frank Milnar, I'm Dr. White, and this is why I became a dentist. And explain that to them so they understand immediately, oh, wow, okay. And it just opens up a lot of other different arenas, and you can kind of just see the patient kind of just deflate in the chair once they understand what the dentist is all about. Because they'll meet the dentist, who is this man, or who is this woman, and what are they all about? And I read a review on Google that says, oh, they're pretty good, but I want to experience it for myself. I think you would agree with that, Frank.
Well, I do, because the most important time is your first impression with the patient. And I don't leverage myself above them and they're laying down and talk to them. I'm really in front of them in a very comfortable, casual position. And I just tell them who I am. I'm somebody who cares deeply about the profession of dentistry. I'm very passionate about people. I'm very curious to get to know you.
Mm-hmm.
It's not what I can do for you. I want to know who you are and what we have in common, how we can share life's experiences together. I'll always be there for you. Sure, we'll look at the teeth in a little bit, but I'm just telling you, I've been through so many phases in my life, and I've seen what works and what doesn't work. And I'm very familiar with both. So you can count on me to be there for you after hours. You're part of my family now. You can count on me, and I will never change my integrity or compromise any of my standards of excellence. For you, I would rather not do anything versus put myself into a compromising situation.
And Frank, everything you just said can all kind of come underneath this heading of the dentist is in the experience business. Because as a patient, if I can experience that, and Frank, if you can do that, you know, with some consistency with me, every time I come in to see you, I mean, all of a sudden you've got someone out there who is an advocate for you and for your dental practice because they know exactly what Dr. Frank Milnar is all about. And there's an expectation of what my experience is going to be once I come and visit you at your practice. That's a huge piece. I think you think you'd agree with that.
Well, Christian, I do, and there's a testimony to that. 3 of my patients are now dentists.
That's
Okay.
right. True. That's very
I'm
true.
on my 3rd generation of patients,
Hmm.
and from the same families. I've had patients follow me for 35 years or more. And during the COVID crisis, I answer those phone calls, the emergencies, and they say, Dr. Milnar, we just want to let you know how much we value you being there for our family, my kids, my grandkids. You've always been there. I trust your judgment. What should I do? And when we re-enter next week, I'm going back to work on Monday, looking different, touching things differently. But what isn't going to change is my ethics. What isn't going to change is my integrity. And what isn't going to change are my standards to be empathetic to the patient and understand the ramifications when I touch teeth, what happens as a result of
Amen. That was wonderful, Frank. Um, to all our listeners out there, this is grade A, top choice stuff that that we're talking about today. So please take notes and write that down. You're talking to a dentist who's got lots of experience and lots of success doing just exactly what he says he's doing. So that was very important. Frank, thank you very much for that.
that. I'm Frank Milnar, a dentist for 43 years. I'm the president and CEO for Milnar Mentoring, designed to make you more competent and confident with your clinical dentistry by receiving personalized mentoring, which reduces your procedure time and increases your profitability. I look forward to working with you in the future.
Now we're going to get into some really interesting stuff here. And everything you've said has been unbelievable and top shelf, but let's focus in on the hiring process that all these younger dentists are going to have to go through. All these dentists are going to have to get in front of an employer, a potential employer, and sell themselves on what is the value that they bring. Now, as an entrepreneur, Frank, and as a very successful dentist, you have been in that position across from the younger dentist. You're asking the questions, and in your mind, you have some things that you're looking for. And I think those things would be really good golden nuggets for the younger dentist to know. So why don't you start out by sharing some of those, please? That'd be great.
Well, I'm also a board examiner for accreditation, and I have other people sit in front of me, and they tell me why I should pass them, or I proofread articles. I'm a consultant on editorial review boards. If it's you, Christian, sitting in front of me, first of all, you might have been the 10th one I've interviewed. Okay.
True.
Same in dental school. There's a whole stack, maybe 1,200 Christians. that are trying to get in and get maybe 100 positions or less. So the first thing I'm going to look at when it's your turn to interview, I've already read what you gave me for content. I know where you're from. I said, what are your hobbies? I kind of know the front page news about you. But now I want to find more, because when you meet a patient in my practice, I want somebody who can go live and not just have scripted answers or look uncomfortable talking to me. I want to look at your posture. I want to look at, are you going to make eye contact? I want to look at all the X factors you have so I can put your application into the short stack on the left versus the thick stack of not going to hire you on the right. The first thing I'm going to do is stage it. Make you feel comfortable that you can talk to me, not intimidate you. Hi, I'm Dr. Milnar. Thank you, Christian, for sitting in front of me and coming for applying to the job. We really appreciate you taking the time. I'm sure this is a big day for you too, as well as me. So I see you graduated from dental school in Minnesota, and you just graduated. And I see you, oh, you did shadowing. I see you shadowed in that. And I said, now I'm going to up the ante a little bit. I'm going to take you into the next level and see how you handle it. Christian, thank you. And I see you had 60 hours of shadowing. You went through a lot of different practices and everything. Tell me about those experiences. Now I'm going to wait for you to talk. Are they canned? Are they meaningful? Or are they generic?
Mm-hmm.
This is your first hurdle. What I'm looking for is the person that says something different than the rest. Oh, I saw, yes, I went to the practice and they did a lot of procedures. I saw an implant, and then I saw how they extracted a tooth, and they had a digital scanner for a crown. Christian, that's the how and the what. I'm not looking for that. I'm looking for the why. Why are you sitting here?
Mm-hmm.
Dr. Milnar, I met this incredible mentor of somebody who inspired me, Dr. Christian White. I couldn't believe the interest that that person showed in me. And when I shadowed that Dr. White, how he related to the patients and how they felt so comfortable in the trust factor and how he treated his staff. He seemed to be the least important person in the room. And I was impressed that somebody would take that much time and show me how success is achieved through hard work, dedication, sacrifice. That's what I want to hear. Who inspired you? Christian, tell me, who inspired you to become a dentist? Well, my dentist in the town I grew up in, I always thought he was a nice guy, and I liked the way he was touching the teeth, and I always liked those little tools. And I thought he said that dentistry is pretty good. That didn't get you over the hurdle.
No, it did not.
What gets me over the hurdle is, my dentist, one time I had a toothache and my mom took me there, and the man was so kind and he gave up his personal time, and he showed me what care is. Somebody who really cares, who will hold people through good times and in bad. And I knew we had hard times. We didn't have much money, and that dentist really cared about my family. He did some work and didn't even charge us. He was fair to my family. He cared about us as people and my whole family. That inspired me to help people. I like helping people, not only from the clinical standpoint, but as being a fellow human being. That's hurdle number 2. Hurdle number 3 gets bigger.
Okay.
Hurdle number 3. Okay, what do you like about dentistry? Why should I hire you, Christian White? Tell me about the things that will make me take note of your skills and consider you to become part of the team. Well, I like Crown and Bridge. I got nice high grades from my instructor. He said my work was real good. And I like Crown and Bridge. And I thought I did real well in dental school. And that's why I think I'm going to be a good dentist because I did well in dental school. Didn't get you over the hurdle.
No,
Okay.
no.
What's going to get you over that third hurdle now? This is like you're in special ops training, you're going over the wall with a rope. Okay. Now you got to get up there and get higher and really show me you can get over the wall. Dr. Milnar, what I found the most interesting besides the clinical skills that all your applicants have clinical skills,
Mm-hmm.
I found that it wasn't enough to let me really understand the profession of dentistry. And I'm looking for a clinical mentor who can guide me through my early years and be there for me and give me some sound advice. What I'm learning, Dr. Milnar, is that when I studied dentistry, I became more inquisitive about art. I studied art. I did some pottery. I went in over to get some extra training. I hung out with an artist. I thought this was fascinating where colors come from. You know, what really drove me was the study of engineering because I found so many similarities between dentistry and engineering. I know it can help me in my career to understand how things fall apart and how do you put them back together again.
Mm-hmm.
You see, Christian, that gets you over the wall.
It does.
And I
Yeah.
would say before you get over the wall, you're almost at the top and you want to climb over and everything. I'm saying, like Columbo said, excuse me, just one more question. What causes tooth sensitivity? Now I'm going to look at you and wait for you to answer that question. This is a tough one. I'm waiting for somebody to hear what causes tooth sensitivity is the dentist. Okay? It's you. How do you prevent it? How do you explain it? And what do you do when it comes your way? How do you counter it
Mm-hmm.
and tell the patient before it happens? Worst case scenario, Christian, I hire you and the tooth is fine and you do a procedure and now the tooth hurts, needs a root canal, and now I get the call. That young dentist that you had, a tooth didn't hurt, he charged me $400 and now the tooth hurts and I need a root canal. To explain that one to me, Dr. Milnar.
Wow.
That's where you get over, you give me that answer, you get over the wall.
Mm-hmm. Okay. I in I've hired dentists and I've interviewed dentists, and I think dentists are very good at talking about the clinical piece. These are all the different things that I've done, and that's all wonderful, and I know that. But I'm looking for is what value are you going to bring to the dental practice? Frank Milnar, what value are you going to bring to Christian White's dental practice? And besides just being able to do a crown prep in 60 minutes, besides being able to do, I would like to do ortho and implants, and those things are all wonderful, but what else are you going to bring? Now, Frank, I'm looking for a little bit of an out of the box piece here in terms of, have you had any experience doing any marketing? Have you had any experience with, how do you talk to the patient? What are your communication skills like? I think, and these are things I know that you focus on as well, but I'm looking for those things because I know that if this young dentist is going to be successful, he or she's going to have to do more than just be able to say to the patient, well, you need a crown, like you said, or you need to have a filling. There's got to be the ability to communicate and to be able to help the patient understand why they need it. That's a huge piece. And, and I'm always kind of testing to see where they're at on those things, Frank, because the dental practice will just soar if I can find younger dentists who, aren't experts coming out of dental school, but have some of those skills, and we can build those, and we can really, really do some great things for that young dentist once we hire them. I think.
Well,
Go ahead.
Christian, too, the signs are all over please leave us a review. I'm going to take that sign and put it right in front of you. You see this? You're
Yes.
graded on every
Yeah.
patient. They can tell, they may not tell me,
Right.
but they're going to tell the world what they think
Mhm.
about Christian White. I like Christian White. He was very good listener. He listened to me. He had my best interest at heart versus his.
Mhm.
That would be good. This is what you're going to hear. This is the best case scenario. I didn't. I wouldn't come back to Christian White. He was in a hurry. He didn't explain things. He gave me a painful shot. He was. His hands were rough in my mouth. He didn't treat his dental assistant like a partner. I felt like I didn't belong there. That I was serving him versus that dentist serving me. That's what I would tell you, Christian, about marketing and social media.
You're right. After every you've always said this, and then you're on stage every minute you're in that dental practice, and the patients are watching you every second. And if you don't listen, I think that's a good word. If you don't listen, then and the patient doesn't feel like you paid attention to them or listened to what's going on with them, then they won't come back.
And I've learned the hard way, Christian. I've made every mistake in the book as a dentist, and I can't take it back, but I learned from it, and I learned my lesson very well. And I can't tell you what to do as a
Hmm.
young dentist, but I can tell you what not to do, and that's the most valuable lesson of all: is how to prevent things from happening that aren't good.
That's very true. Um, I think in this new norm that we're in, Frank, a lot of what we're talking about is going to be more important than ever. It really is. Um, and I think we're gonna talk some more about that as we continue to go through all this information. But yeah, that's going to be very important. Okay. Well, Frank, I just wanted to say to you, uh, thank you for being on the show today. I thought that the information, that the conversations we had were unbelievable, and I think the younger dentist is going to really, really benefit just unbelievably from listening to you. Thank you very much.
My pleasure, Christian.
Appreciate it, Frank. And Frank, if the younger dentists want to get in touch with you, what's the best way for them to do that?
Well, as right on the screen, Christian, I have my mentoring website,
Hmm.
www.milnarmentoring.com, that they can check out content, questions, etc. Or my email, drfrank@milnarmentoring.com. And that's a good way to reach out to me. I have dentists that are reaching me from all over the world, whether they're doing a graduate study and they're reading my articles and they want to know if I can be referenced or anything. This is what education and mentors are all about. It's selfless, and this is what I do in my spare time. I give back.
Thank you for listening today. I'm Christian White, the CEO of White & Associates Practice Consulting, Better Business, Better Dentistry. If you would like more information on today's topic, you can contact us at whitedentalconsulting.com/breakdown. Keep those teeth white and see you next time on the Dental Breakdown Show.